Good afternoon, everybody. Welcome to our informational webinar for the Systems for Action Call for Proposals. I am Lisette Fowler, and we will start the session right away. I know there's we want to save as much time as possible for question and answers. So just to begin, a few housekeeping notes. This session is being recorded, and the slides and a link to the recording will be sent to all the registrants who registered for the seminar, so you will be receiving that after the call. In addition, the presentation will be uploaded in our Systems for Action website under the Funding Opportunities page. And furthermore, all the attendees will remain on mute during the call. So we're using the chat box that you can see on the bottom left-hand corner of your screen to submit any questions. Please remember that we can't answer any project-specific questions. These are just general questions you might have about the call for proposals. If we don't have time to answer all of the questions, we will reach out to you, and you can follow also our Q&A on our website. So just a brief agenda. Our program officer, Carolyn Miller, is going to talk about the Systems for Action and building culture of health in the action framework. We're going to have a discussion on our call for proposals. I'll give you some brief information on how to apply, and then we'll follow with Q&A. So just a few introductions from the National Program Office. We have the Director of the program, Dr. Glenn Mays. Our co-director, Dr. Anna Hoover, is also on the line, but she's on mute, so you won't be able to hear her. Of course, the Deputy Director, and Ann Kelly is our Program Manager. From the Robert Wood Johnson Foundation, we have our Program Officers, Carolyn Miller and Octavia Rojic. And Carolyn, to get things rolling, I'll hand it off to you for a discussion of the action framework.
Good afternoon, everybody. Thank you so much for your interest in the Systems for Action Call for Proposal. We're really excited about this next CFP. I just want to give you a brief overview of the Culture of Health Action Framework. As you may know, the Robert Wood Johnson Foundation has a vision to build a culture of health in this country, and part of that effort involved the development of the action framework that you see here on the slide, and with it a set of measures and 4 action areas, and within each action area there are 3 drivers, and then there are some illustrative measures that are associated. So I would strongly urge you to go to cultureofhealth.org, and there's a tab on that website that says Explore the Action Framework. And once you go to that tab, you'll see, in addition to the 4 action areas that you can see here on the slide, you'll see that there are the 3 drivers within each. And we think of those drivers as really the engine of the action framework. These are the specific areas for action that we think are really important for instance, fostering cross-sector collaboration to improve well-being. That's action area 2. And within that, we have 3 drivers: the number and quality of partnerships, investment in cross-sector collaboration, and policies that support collaboration. So as you view the 4 action areas and learn more about the drivers, we'd like for your proposal to focus in and highlight which of the action areas and drivers you feel your proposal is most relevant for. I just also want to say that, as you'll see on the website, there are 41 national-level measures that we have associated with the action areas and the drivers. You don't need to use these measures. These are really the Foundation's measures to track the nation's progress to building a culture of health. So we'd like you to focus your connection of your proposal with an action area and a driver. And it may well be you can focus that your particular proposal is relevant for more than one action area and driver, and that's fine too. So I would strongly urge you to look at the Culture of Health framework. I don't want to take up too much time here. We have a lot more specifics to go over about the CFP. So I'm going to hand it back over to Glenn to start that conversation.
Fantastic. Thank you so much, Carolyn. And so I will take you in a little more depth about the research solicitation under the Systems for Action program. Systems for Action is one of now 4 signature research programs of the Robert Wood Johnson Foundation that are working to build more and stronger evidence to support the culture of health and the culture of health action framework. And Systems for Action, our program, obviously as the name implies, focuses squarely on systems, building evidence for how to better connect and align systems, delivery, and financing systems that support a culture of health. And the slide that you're seeing here, it actually shows references the research agenda that was developed about 1.5 years ago to support the research directions under this program. We strongly encourage you to take a closer look at this agenda and think about how your project, your study ideas may align and fit within this agenda. But the big picture for Systems for Action is we're interested in research that can help us learn about novel ways of better aligning and integrating delivery and financing systems that support health and well-being. In particular, thinking about medical care, social services, and public health services, the delivery and financing systems that support those 3 sectors of activity in improving health and well-being and addressing inequities in population health. The rationale for this system alignment focus of the Systems for Action comes obviously from the growing body of evidence that we have stressing the variety of social, economic, and environmental determinants of health. We know that the majority of factors that impact health and well-being at a population level exist far outside the medical care system, and again touches on social, economic, environmental determinants and on the behavioral aspects of those elements as well. So there's many different sectors and systems drive health, but the problem is that our delivery and financing systems that support social, economic, and environmental strategies for addressing those determinants, that constellation of delivery and financing systems are often not well connected. They are fragmented, they are siloed, despite the fact that they're really fundamentally trying to target the same underlying determinants of health. And so our goal through this research program is to learn about new and innovative mechanisms for connecting the dots across those sectors, across the medical care, across the public health, and across the social and community services sectors to reduce fragmentation, to improve coordination and alignment and integration, and ultimately to improve health outcomes and to promote health equity across these systems. To be successful in that, to be successful in aligning many different fragmented delivery and financing systems that exist across the health and social sectors, there's lots of challenges that need to be overcome, lots of barriers to coordination and alignment. And so we're looking for innovative ideas to address these collective action problems that you see here. Fragmented funding streams, problems with incentives that are not well aligned, time lags between interventions and outcomes, difficulties in measuring progress, insufficient infrastructure and institutions to support cooperative activity, many different types of challenges. We're looking for innovative ideas for addressing these challenges and mechanisms for alignment. Obviously, as the culture of health action framework stresses, to be successful in this kind of research and building this kind of evidence, there are many different sectors that are potentially need to be engaged in the research and in the mechanisms for system alignment. So we're obviously we are interested in mechanisms that can engage the health and medical sectors, medical care providers and public health organizations. But we're also looking for studies that can extend beyond the health sector into larger social and community service sectors and the systems that support those activities, including the food environment, education and workforce development, housing, transportation, criminal justice, the education sector, and many other systems that exist in that broader constellation of social and community services. All of these are sectors that are potentially relevant to the studies that we're seeking to support through this solicitation. Now, I want to just share with you a little bit about how the Systems for Action program is currently organized and how it currently operates. This is a program that was implemented by the Foundation about 18 months ago now. So we do have an existing cohort of studies that have been funded under this program already and that are ongoing. And you certainly want to be aware of those existing studies. And if you're looking at the web slides for today's session, you can see the program structure here. Our group at University of Kentucky functions as a national coordinating center, coordinating the variety of research studies that are underway, examining methods for system alignment. We are partnered with 3 collaborating research centers that exist around the country, one based at University of Chicago, one based at Arizona State University, and a third based at Indiana University, Purdue University in Indianapolis. Those 3 collaborating research centers are working with the National Coordinating Center in Kentucky to implement some of our initial research in this space, examining mechanisms for system alignment. The 3 collaborating research centers has a large-scale research project underway, and they're also working with a variety of community partners and stakeholders in the conduct of their research and in translation activities. Additionally, in the bottom portion of this program structure graphic, you see there are a number of individual research projects, 4 of them, in fact, that were funded last year under our first solicitation for individual research projects. And those projects are based at Drexel University, Michigan State, University of Delaware, and the Los Angeles County Department of Public Health. Those were 4 projects funded under our very first solicitation for individual research projects. What we're now talking about today is our second solicitation to identify an additional cohort of individual research projects to join this research endeavor and to add to the evidence base around how best to align delivery and financing systems. But we do encourage you, as you're looking at this opportunity and developing your project ideas, you want to take a close look at the projects that have already been funded through the S4A program. Both projects that are underway through our 3 collaborating research centers and projects that are underway through our 4 existing individual research projects, just to make sure that what you're proposing is going to add value and is going to be innovative and be add new evidence to the program. So now I want to talk a little more specifically about the currently open Systems for Action call for proposals. What we are looking for in this call for proposals are project ideas that provide that will conduct rigorous research that are testing novel mechanisms for aligning health and social systems in ways that activate the Culture of Health Action Framework. So if we're looking for projects that are going to test new ways of connecting the dots across medical, social, and public health systems in ways that can promote health and well-being. There are 2 categories of projects that we're soliciting and that are described in the call for proposals. Category 1 is a category for exploratory and developmental projects. These are projects where you have an idea for a novel way of connecting health and social systems, but that novel mechanism for system alignment has not really been tested yet, and the project needs an opportunity to refine the design of the approach, to test the approach for its initial feasibility, and to get some sense of the potential impact of the approach going forward. So that's category 1, designed to support early phase, initial proof of concept and feasibility testing of a novel approach for aligning health and systems. Category 2, the second type of projects that we'll support through this solicitation are the individual research projects. And these are more full-scale research projects that are designed to test the impact of a mechanism for system alignment that is of interest. So 2 different categories that you can apply to. What should successful proposals include? Again, first and foremost, we're looking for proposals that are proposing to test, again, novel mechanisms for connecting delivery and financing systems across sectors, across the medical, social, and public health sectors. We're obviously looking for mechanisms that tie in very closely to the Culture of Health Action framework and to the drivers of those action areas that Carolyn Miller mentioned in her overview of the action framework. So novel mechanisms that can activate key drivers of the Culture of Health Action framework. Ultimately, we're looking for mechanisms for system alignment that can have a meaningful impact on health and health equity. And we're also potentially interested in understanding economic outcomes as well. So we want projects that are focused on moving the needle on outcomes, health outcomes, potentially broader measures of well-being, and potentially economic outcomes as well. And then fourth and finally, very, very important here, all the projects that are supported under this program should use an explicit equity lens. We're looking for novel approaches for aligning systems that can reduce inequities in population health and help to promote equity in health and well-being. So these are four fundamental pieces that really any proposal should have in place and should make clear. In terms of more specific research questions, as the call for proposals announcement makes clear, there are four elements that your research questions should touch on, and as you propose ideas for this opportunity. One is the specific delivery and financing systems that your project is designed to connect or to align. And again, there are many potential delivery and financing systems out there that may be relevant to health and well-being. Those systems that are in the medical care sector, systems that involve public health programs and services, systems that involve a broader constellation of social and community services, housing, transportation, criminal justice, education, labor and training programs. So you want to think carefully about what specific delivery and or financing systems is your project designed to connect or align. Secondly, we're looking again for projects that are testing novel, innovative mechanisms for aligning those systems. So you want to be clear about what mechanism or set of mechanisms your project is going to test, mechanisms for connecting the dots, for aligning systems across sectors. These mechanisms could take any number of forms. These could be different new types of partnerships among organizations. These could be new financing and payment methods. These could be new information systems, new governance and decision-making strategies. These could be new ways of organizing the workforce across sectors, regional approaches to service delivery and financing systems. So any number of mechanisms may be relevant here, but you want to be clear what mechanisms is your project testing, mechanisms for aligning activities across systems. Third, you want to be clear about the community settings and the population groups that are of interest. What communities, what population segments are served by the systems that your project is attempting to align and integrate. And then fourth, we're always interested in using the most rigorous methodological approaches that we can to learn about the implementation and the impact of the strategies that are being tested to align systems. So certainly we're interested in learning about testing new methodologies or testing methodologies that come from a variety of different disciplines and fields, and testing them now for the purpose of studying system alignment strategies. So there's a wide range of potential methodologies that you might want to bring into play that help us understand opportunities for connecting the dots across delivery and financing systems. So you want to think about all four of these areas in your proposal. The systems you're trying to align, the mechanisms you're using for aligning those systems, the community settings and population groups, and the methodological approaches you're using to study these innovations. So next, I do want to call your attention to some priority topics of interest that the Foundation has identified in this specific funding opportunity. There are, if you read the call for proposals, you'll see there's a section that identifies several priority topics of interest, and these that have been identified by the Foundation and other stakeholders in looking at the range of studies that are already underway in the Systems for Action program, and looking at really where do we have kind of some high priority gaps in knowledge, some priority gaps in evidence where we'd really like to see some new studies proposed. And these priority topics are what you see on the screen now, and are also articulated in the call for proposals. First of all, we're interested in projects that are studying mechanisms for system alignment that operate at a community or population level, as opposed to an individual level or a patient level. Certainly, we have several studies underway now through the program that are looking at more individual level mechanisms for aligning systems, and so we'd be especially interested in new project proposals that propose to look at community level or population level approaches to aligning delivery and financing systems. Second, we're interested in studies that might take a look at financing and payment mechanisms as ways of aligning systems and sectors. Third, we're interested in studies that might focus in on methods of public deliberation or community engagement as mechanisms for aligning activities across systems and sectors. Fourth, we're interested in projects that might specifically look at the role of the private sector in helping to align systems across the medical, public health, and social services arenas. The role of the private sector in addition to perhaps the role of government strategies. And then fifth, our fifth priority topic identified in this round has to do with system alignment mechanisms that operate in rural settings and in other low-resource settings. We have a number of studies ongoing now that are looking at system alignment strategies in more urbanized areas, and so we'd really like to see some new proposals that focus squarely on rural settings and/or other low-resource settings to help us learn how to connect the dots across systems in those types of contexts. So definitely take a close look at the priority topics. Your proposal does not have to address one of these priority topics, but again, we're especially interested in seeing proposals that could address one or more of these priority areas of interest. A few other aspects of the proposal process and things that we're really looking for in strong proposals. One has to do, obviously, with the expertise of the research team. We're looking for multidisciplinary approaches for testing system alignment mechanisms. And we're looking for projects that can bring together teams of people with expertise in both the relevant theoretical constructs, the relevant methodologies that need to be brought to bear in these studies, and also people who got relevant on-the-ground operational expertise in how public health or social services or medical services operate. So the strength, the multidisciplinary expertise of the research team tends to be very important in these proposals. And again, we're looking for teams that have expertise that cut across all three of those sectors that we're trying to align: medical care, public health, and that broader constellation of social and community services. So you want to make sure you've got the right team, you're pulling together the right team that can bring expertise in those relevant areas. A few other considerations of interest. The Systems for Action research program is one of the Foundation's what are called 4 action research programs, and that means we are conducting research with action in mind, with the goal of producing evidence that can be rapidly put into action by stakeholders in the worlds of practice and policy and communities. And so We're looking for proposals that are already thinking carefully about how the evidence that will be produced through their projects is going to be acted upon by relevant stakeholders in policy and practice and community. So you want to think about that up front. Related to that, we're looking for projects that can build strong stakeholder relationships with the communities and the communities of practice that are well positioned to help the research be conducted and then be translated into practice. And so projects that can make use of mechanisms like practice-based research networks or community-based participatory research collaboratives, projects that can take advantage of translational research infrastructure or other. We're looking for projects that can tap into other mechanisms for community engagement, stakeholder engagement in the research approach. Thirdly, important to recognize that a wide variety of institutions may be well positioned to take on the kind of projects that we're looking to fund through this solicitation. Certainly, academic institutions and research institutions in a wide variety of settings would be appropriate to apply for this setting. But this funding is not limited just to academic and research environments. Given the emphasis placed on innovation and on action, organizations that exist in community settings, government agencies, are also likely to be well positioned to carry out the kind of projects we're looking to fund in this solicitation. Particularly organizations that have got an innovative idea for, again, how to align delivery and financing systems across the medical, social, and public health space. So a wide variety of organizations are potentially relevant here, not just academic and research institutions. And in fact, likely we encourage organizations and applicants to think about ways of collaborating, building strong collaborative approaches to conduct the kind of work we're looking to support. Just to reiterate, there's two categories of awards, two different types of projects that we're seeking to fund through this solicitation. Category 1 is the more early stage research, exploratory and developmental projects. Again, this is for projects that are testing the early proof of concept of a novel idea for how to align delivery and financing systems. Category 1 projects need to be able to be completed within 12 months and with funding awards up to $100,000 in the total award amount. And so here again, the focus again is early proof of concept studies, testing the feasibility of the approach, refining the design, and getting some early evidence about the potential success of the approach. That's category 1. Category 2 is a somewhat larger scale research. Is designed to support somewhat larger scale research projects. These are category 2 projects will be studies of up to 24 months in duration. That will receive funding of up to $250,000 in total funding. And these projects should go beyond just looking at implementation and should be able to study the impact of the system alignment strategies that are being tested. And so these projects should use more complex research approaches, more rigorous research approaches in study design, with the goal of supporting sound causal inferences about the impact of the system alignment mechanisms that are under study. So you want to think carefully about which of these two categories of award does your idea best fit into. Is it an early stage approach, proof of concept approach, or are you really ready to propose a strategy that's going to test impact? In eligibility, a broad array of organizations are eligible, public entities and nonprofit organizations that are tax exempt. Your organization needs to be based in the United States or its territories. These awards go to organizations, not to individual investigators. And again, we encourage multi-organization consortia, collaborative arrangements, and encourage those kind of arrangements but if you use a consortium approach, there needs to be a single organization that's going to function as the primary applicant for the collaborative. In the review process is outlined in the call for proposals document that you can review in more detail. We'll be reviewing both categories of project proposals simultaneously. The Category 1 proposals will use a single phase review process. There'll be a 6-page proposal narrative that you'll support, along with additional materials and a budget. Those materials will be reviewed as a one-phase process. They will be reviewed by a review panel that includes members of the National Advisory Committee for Systems for Action, along with additional reviewers that are recruited based on subject matter expertise. This review process will be carried out for Category 1 proposals during spring. We anticipate being able to notify notify applicants about funding recommendations by early July. For Category 2 awards, if you're applying for Category 2 awards, there will be a 2-phase review process. The first phase starts with a 6-page brief proposal narrative that you'll submit. That will be reviewed by our review committee, and then we will be inviting a limited number of those applicants to submit full proposals, and those full proposals will need to go in early July. The full proposal will allow you to provide a little more information about the research approach being proposed as part of a 12-page proposal narrative. The full proposal applications will be due August 1st. We'll have a second stage review process, and then funding decisions will be announced in early October for the Category 2 awards. The selection criteria, again, are also outlined in the call for proposals document. They involve the 5 categories you see here on this slide: the significance of the idea that's being proposed and the problem to be addressed, the system alignment problem being addressed. Secondly, innovation. How innovative is the system alignment mechanism that you're proposing to investigate? Third, the strength of the multidisciplinary expertise that is brought to bear in the research team that you propose, including both scientific as well as operational and practice level expertise of the team. Fourth, we'll look at the strength of the environment that is available to the applicant, including the research environment as well as the community environment, and the strength of the collaborators and stakeholders that are engaged in the process. And then fifth, finally, the final selection criterion has to do with the strength of the research approach that is proposed, the scientific merit and feasibility of the research approach that is proposed. So just to recap important dates, May 5th, 2017 is the deadline for the receipt of proposals in response to this call for applications. Both the Category 1 proposals and Category 2 proposals are due by 3 p.m. on May 5th and need to be submitted through the Robert Johnson Foundation's electronic proposal and application system. By early July 2017, we expect to be able to notify applicants for the Category 1 awards about the funding decisions. For Category 2 awards, in early July, we will be able to notify those applicants who are being invited to submit a full proposal. Those invitations will go out in early July to Category 2 applicants. And again, for Category 2 applicants, they will need to submit full proposals into the system by August 1st, and then funding decisions for the Category 2 awards will be announced in early October for projects that will start on or before November 15th of 2017. And these dates are also, again, outlined in the call for proposals document. Okay, I think I'm going to turn it back over to our Deputy Director, Lizette Fowler, to talk about some of the finer points in proposal submission.
Thank you, Glenn. Okay, so of course you're welcome to contact us anytime if you have any questions about the actual application system, but as mentioned earlier, all applications are submitted through the Foundation's official online application system, and it's actually very easy to work with. When you click on the application link, and you can get this application link either through the systemsforaction.org website, under funding opportunities, there'll be a link, and that'll take you directly to the actual RWJF application link. From that, it takes you through the funding opportunities page. It takes you, to the online RWJF application system, which is myrwjf.org. You'll be asked to sign in if you have an account with the Foundation. If not, you'll be asked to register and set up an account as a first-time user. And then once you do that, it'll take you directly to all of the funding opportunities that are currently available, but the CFP for this specific call for opportunities will be on the very top of that page. So when you click on that link, then it'll take you to the page that's shown on your screen. It has the title of the call, and it's actually very, very simple. You just follow all of the sections that need to be completed, and each section is very specific about what information needs to be included, the actual template for your both project narrative and any budget narratives if necessary. And then once you complete all of that, there'll be a submit button. One important factor, and that's what I want to point out in this page, if you see the red circle there, you can invite multiple users to contribute to the application process. Again, we're interested in partnerships, so we know that you'll be working with many people who will be contributing to the system, to the proposal. So when you click on that link, it takes you to this invite contributor link, and you enter the person's email address, you put OK. After that, it takes you to another screen that allows you to restrict whether you want this person to just view, edit, or actually be able to submit the proposal. So it's actually very simple, but please, again, don't hesitate to contact us for any questions on that. And in order to leave plenty of room for questions and answers, we'll start on that right away. And I know we have some queued up, so I will read these, and Dr. Mace, if you want to help answer, that would be great. The first question I think deals with, and sorry, remember that we can't answer very project-specific questions, so these are going to be more general type questions. Again, we do have some answers Q&A currently on the Systems for Action website, and we'll be adding to this from the call today. So the first question deals with methodologies. The question is what research methodologies are acceptable. And I know we touched on that briefly.
Yeah. Thanks for that question. Again, just to reiterate, this program is very, very ecumenical when it comes to research methodologies. We are studying, we're interested in producing rigorous and relevant evidence about how to align systems. So the relevant methodologies, both qualitative and quantitative, or potentially many and wide-ranging. We welcome you to pull methodologies from a variety of disciplines. Obviously, there's a growing body of methodology in the kind of system science domain that includes strategies like network analysis and agent-based modeling and other approaches to kind of visualize and study systems. Those methodologies might be relevant to certain approaches that you may take, but there's a wide range of other methodologies as well. We encourage you to try to be innovative in the methodological approaches that you use, both methodologies for data generation and data analysis, but also to think about your methodologies for stakeholder engagement in your research approach, and methodologies you may use for translating evidence back to clinical and policy and practice communities. So, but short answer is we're open to any and all methodologies that help you answer important questions about how to align and connect the dots across systems.
Thank you for that. The next question has to do with population size. So this is a community that they have some urban issues that they're not able to meet requirements of a certain population size, and so they want to know, is the Foundation considering flexibility to consider the size of the community?
Absolutely. There are no population thresholds or other size limitations in terms of the kinds of research that we're interested in supporting through this initiative. In fact, again, the list of priority research areas that I mentioned earlier and that are articulated as 5 priority areas of interest, one of them has to do with we're interested in research that tests system alignment strategies in rural and other low resource settings. And so that is an area where we recognize we have less evidence about how system alignment strategies really work in smaller and rural communities. And so we welcome innovative ideas that are being tested in smaller sized communities, certainly.
Great. Another question deals with, it says, should the project focus on all 3 settings, medical care, public health, and social and community services, or can projects focus only on 2 areas for alignment? So that is a great question. I can tell you certainly that we're especially interested in projects that can cut across all 3 of those kind of meta sectors, the medical care sector, the public health sector, and the social or community services sector. We're interested especially in, again, mechanisms that can in some way cut across all 3 of those areas. And the rationale is, again, just back to social, what we know about social, economic, environmental determinants of health, to really tackle those fundamental determinants of health. There are roles to be played by actors in all 3 of those sectors. So we do encourage you to think creatively about how you might engage actors in all 3 of those sectors in your work. Thank you. The next question deals with the focus of population, the population of focus. So, for example, this group wants to do something very narrow, for example, teen mothers. Is that all right, or does the population need to be broader than that?
No, absolutely. We recognize that that projects are going to need to define their population groups of interest, and obviously to address this fragmentation across delivery and financing systems, we often, to get a good handle on those issues, we need to focus specifically on the population groups that are most affected. So certainly you should focus on the population groups that are most relevant for the addressing who are most at risk of experiencing fragmentation and lack of integration in the systems and supports that they need to be healthy.
Thank you. We also have a couple of questions regarding the credentials of the PI. Do you have to hold a PhD in order to be the PI of a project, or does the research team require anybody as a member of the team to have a PhD?
Good question. I would say there in terms of eligibility criteria, there's no criteria that specify specific educational backgrounds and degree requirements. So there's not a fixed degree requirement associated with this funding opportunity. What we do say is, you'll notice one of those 5 review criteria relates to the strengths of the multidisciplinary research team that is proposed for the project. So we encourage you to think carefully about what expertise is needed to carry out the project that you propose, and make sure that you've got that expertise represented in the team of people that you're proposing to be the key personnel for the project that you're proposing. This is a research program, and so we are looking to build evidence, but we're looking to build evidence across a number of different types of projects, including Category 1 projects in particular that are very early stage proof of concept types of studies. And so I would say, especially for Category 2 studies, where we're looking for a much more scientifically rigorous approach to estimating the impact of your system alignment mechanisms, probably for that category of awards, it's especially important to make sure you've got the right depth of methodologic expertise, research expertise on your team. But that being said, there's no requirement for having, the PI needs to have a certain degree, or there needs to be certain degrees represented on the team. We're looking for you to make the case to convince the review panel that the team, the multidisciplinary team you've put together, has got the requisite expertise and experience to carry out the project as you've designed it.
Thank you. And that leads to this next question. You have people who have a very relevant research project, but they need a research partner. Is there any assistance in making partner matches? Making partner matches. So I would say at the coordinating center are glad to talk with you about those kinds of issues. We can't guarantee that we can play matchmaker around this opportunity, particularly given the tight time frame. But we're certainly glad to entertain questions that you have about that and provide any guidance that we can on that regard. We encourage you also, again, to look within your networks, the constellation of organizations, people that you work with. Use your networks as well to identify people who can bring appropriate research and scientific expertise to the team you may have. So think carefully. Are there community-based research networks that you can tap into? Is there other kinds of collaboratives that involve scientific and practice-based stakeholders within your network of relationships you can draw upon? But certainly we're glad to provide any guidance on that front as well from the National Coordinating Center. But we can't guarantee that we can play matchmaker for you given the time frame involved. And then leading to that, we have a couple of questions about not having those potential partnerships in line right now, and wondering if this is a funding opportunity that might be replicated next year or in the future. Sure. Good question. Actually, if Carolyn is still on with us, maybe she might want to say a few words from the Foundation's perspective.
Sure.
Yeah.
So this is the first time we're doing those first kinds of awards, those Category 1 awards under this for this research program. So we aren't sure what kind of response we're going to get to that. If we get a good response, and assuming we have another CFP next year, which we certainly are hoping for, I think it very well might continue. We can't guarantee that it will. We're hoping that we get a good response and feel as though this is something that there's a need for, and we would certainly like to, and we hope to next year.
Mm-hmm.
Great.
Thank you, Carolyn.
Another question has to deal with financing systems. The question is, does financing systems need to be part of every alignment study? For example, if someone wants to study racial inequities or in a rural system, do they need to include financing specifically?
Great question. The short answer is no. We're interested in strategies that are mechanisms that are focused on aligning the relevant delivery and or financing systems that are of interest to your project team. Some of the fragmentation that we see across health and social and public health systems has to do with financing mechanisms and payment policy and funding streams. Other sources of fragmentation do not involve financing at all, and so it's really you want to identify the target for your project based on the system alignment problem you want to solve. If it relates to money, you may want to think about an angle that touches on financing or payment systems or funding streams. If it relates to other sources of fragmentation or discontinuity, lack of integration, you want to focus on those other elements, those other kind of systems that are causing problems or that need to be aligned. So it's really up to you. You want to tackle the systems that are, from your perspective, at the root of the problem that needs to be solved.
Another question is, can retrospective studies that have data on previous programs be used?
Yes, absolutely. A variety of retrospective study designs and approaches can be relevant here. I would say especially for the Category 2 awards, because we recognize the Category 2 awards, they are larger scale awards, but we're still looking for evidence that can be produced relatively expeditiously. These are 2-year awards, and so there's, even with the 2-year time frame, there's not an unlimited time available to do a lot of primary data collection and prospective types of approaches. So retrospective research designs are welcome, as well as combinations of both retrospective and prospective. We recognize you've got to be creative and think about how to produce the best evidence you can within the time and the budget constraints that you have available. So thinking about feasibility is important, and retrospective kinds of approaches can be beneficial in terms of efficiency and feasibility.
Thank you. Here's a question regarding IRB and surveys. As long as the survey procedures comply with national ethics standards outlined in the guidelines, do all proposed projects have to be approved by a university IRB committee?
Good question. I think, and I'm not an attorney, but I would tell you, I think the requirements about IRB requirements are conditioned first and foremost based on the organization that houses the team that is conducting the study. Most universities, for example, that receive federal funds are required as a condition of the federal funding to have a federally designated IRB body that reviews and approves human subjects research that is conducted by individuals in that university. But if your team is comprised of investigators outside of university settings, that particular IRB requirement may not come into place. You need to make sure that you're aware of the research review and human subjects review requirements that your individual institution needs to be compliant with.
Thank you. Here's a question about sustainability of a project. The question is sustainability of a community project important to address rather than a focus solely on implementation feasibility?
I would say certainly sustainability is a relevant component of feasibility that studies may want to address. At least to have some ideas about longer-term sustainability, because if we're discovering innovations and testing them through this study opportunity, but there's no insight about how these innovations might be sustained over time if they're found to be successful, that's going to limit the actionability of the research and the evidence that is produced. So I think certainly applicants are encouraged to think about feasibility, or at least potential pathways for feasibility over a longer term, if their projects are successful and if their studies are successful in showing beneficial impact.
Thank you. Next question is, does the proposal have to be an intervention, or in Category 1, is it acceptable to propose further defining the problem or feasibility testing of the intervention in order to better target future interventions?
Good question. I would say the second piece of that question is the answer would be yes. For studies that are for Category 1 studies that are testing the feasibility of refining the design and then testing the feasibility of some novel mechanism for system alignment, that is absolutely what we're looking for in Category 1. The first part of that, studies that purely are aimed at defining a problem, would probably not fare well under either Category 1 or Category 2. We're looking for studies not just to document problems here, not just to document lack of coordination or system fragmentation, but we're looking in Category 1 for studies that are actually proposing and at least providing preliminary feasibility testing of some solution, some potential solution, some way of aligning those systems. So you don't want to just stop with studies that define problems. You want to actually design and at least test for feasibility a potential solution as part of Category 1.
Thank you. I have a question about and I think I might be able to answer this, the earliest proposal period start date for Category 1. So grants are scheduled to start November 15th. However, we're having internal discussions about possibly being able to start those Category 1 successful applicants before November 15th, but that's still a conversation that we're having and haven't decided on that yet, but yes, that may be a possibility. It may be a possibility to start those earlier. The next question, are you looking for US-based projects only, and do you plan to have this call again? I think Carolyn answered the second question, and yes, the projects must be based in the US only. Next question, if someone applies for a Category 2 project, but you feel it would be a strong Category 1 project, would you reassign the project? And unfortunately, we cannot do that. You have to decide at the application phase which category you are applying for, what best fits the project that you are proposing. Do you have anything to add to that, Dr. Mays?
Nope, that's right on target.
Okay, great. Where does behavioral health fall into three sectors: medical, public health, social services?
I think you find it potentially in all three sectors. We certainly have behavioral medicine. We certainly, a lot of the public health approaches used in the world of public health sector are based on behavioral science, and increasingly insights from behavioral science and health, behavior change strategies are used in a variety of social and community services and systems. So I think the behavioral science perspective and the practice of behavioral science is very, very relevant to this work across all the sectors that are implicated here.
Thank you. There's a couple more questions I can quickly answer here. Where in the website can you find the PowerPoint? Again, the PowerPoint will be sent to all registrants for the webinar, even if they did not attend today, but you may also find it on our Funding Opportunities webpage, and we will be sending that information out as well. The next question is, can more than one department within a city or agency apply? As long as they are separate projects, distinct projects, yeah, more than one department could apply for a separate project, but of course you could have partnerships with multiple agencies for one proposal. The next question, are projects with matching dollars from other foundations eligible? And do you want to, Carolyn, do you want to say something about that? I know that the general information that we have is, as long as what you propose in your project for RWJS, that part needs to be completed, and you have to specify how the different funds are used if there's some additional funding for the same project.
Yep, that's exactly right. Thanks, Lizette.
Thank you. Will organizations, and this is a question that keeps coming up, will organizations, it has to deal with, if you receive funding for Category 1, does that mean you will be eligible for Category 2, but what's the timeline, and I think we've sort of talked about that. I don't know if there's anything else we want to say about that. They want to submit a Category 1 and hope to collect more data in order to be able to submit a Category 2 in the future.
Yeah, I would just caution folks, if you're successful with Category 1, that doesn't necessarily imply that you're automatically going to receive a Category 2 award sometime in the future. As Carolyn Miller from the Foundation noted, they're certainly hopeful that there will be future funding opportunities. And Category 1 awards definitely are designed to position these novel ideas so that they can better compete for larger scale funding to test impact sometime in the future. That funding may or may not be available from the Foundation, but we certainly hope to position these projects to better compete for future funding as a result of their support through Category 1.
Great. The next question, and I know we're running very short on time, can you give more detail on what would or what would not be considered a system? So back to the early.
Yeah, so I think that's an issue that I think we're looking for applicants to articulate how they're defining a delivery and/or financing systems. We generally think about systems as being the constellation of actors that support a given set of activities, programs, services, or interventions. So that a delivery system is the constellation of actors that work together and jointly produce a set of services, activities, or interventions. And the financing system is the constellation of financial resources that then support those activities. But certainly your applicants have the flexibility to define with greater specificity the delivery and financing systems that are relevant for their proposed activities.
Thank you very much. I think we've answered most of the questions. There are a couple questions on here that I know we have already on our Q&A, so you can find that information on the website. And so with that, I think we'll call it a day, and we look forward to hearing from you and receiving some interesting applications for the proposal.